been doing acupuncture since 2001 and got interested in other modalities of holistic medicine. And I have a whole other talk that just educates you on all the different holistic options. Acupuncture is just one of those things. So if there's interest, that's certainly something else I can talk about. But today we're going to talk about acupuncture. And talk about a little bit about the history. And then there's different types of acupuncture. I have sitting up here an electro acupuncture unit, a laser, and then just a bunch of examples of different types of needles you're welcome to come up and look at, different sizes. They're like, this is for horses, and then there's these little tiny tack needles that really, they're useful for people, they're not useful for animals. And if I have enough, I'll pass them around and you can try them. But one really good point that you can do on yourself is what's called large intestine 4. It's right there. It's an immune stimulating point, and in some people like myself, it's chronically painful. Just hurts me all the time. So those sorts of needles are things that you would stick there. And then like my acupuncturist, if I have what we call ASHI points, AHSHI, they're just super painful points that you have all the time. These are the kind of little acupuncture needles you can put in those and just leave them in there for days, and they'll stay on. So I'll pass some of those out in a little bit. And then probably the smallest needles I use on animals are ones that they're that long. Those are the smallest ones, and we use these on the ends of the feet and the paws. Those are really sensitive points, and lots of dogs don't like them, and some dogs are not even acupuncture candidates, which is why I brought two different dogs to kind of show you the different personalities. And although an animal may be really amenable to acupuncture, if their personality is such that you can't acupuncture them without getting bit or without causing a lot of stress in the dog, then it's not worth it. That's where the laser comes in really handy, because it's totally painless. And unfortunately, I forgot the cord. Otherwise, I could have you, do yourself. You feel nothing. The most unnerving thing about the laser is it makes a noise, a beeping noise like that. And some dogs are noise phobic, and that stresses them out. But that's why I have treats. And then there's Acupuncture, which is injecting different liquids in, and I'll get more in depth about that when it comes up. And so we'll talk a little bit about traditional Chinese medicine definitions. And this David Raby that presented a totally different history of acupuncture is in it. Right now there's kind of two fragmented camps of veterinary acupuncture. There's the ones that have been taught the traditional Chinese theories, and that's what I was taught, so that's what I'm going to present. There's a whole nother group of acupuncturists that get certified by either Colorado State or IVAS. Those are certifying places that you can get acupuncture training. And they teach a totally different kind of acupuncture that has nothing to do with Chinese medicine or history or theory. And that's pretty much where it hurts, we're going to acupuncture. So we find ASHI points, and that's where we acupuncture. And that's about as in-depth as it gets. Traditional Chinese medicine, acupuncture is very, very complicated, and it's in-depth, and they use a lot of different theories to pick points. And that's what I'm going to tell you a little bit about. So we'll talk about some definitions, and then we're going to talk about the different theories that people like myself use to pick specific points. And then we'll talk about the Western explanation, the neurophysiology, the plethora of scientific papers that are out there that have published that there is an effect, a neurophysiologic effect to acupuncture, because that's how Western medicine has to look at things. The different uses of acupuncture. So history. So we've been taught that it's one of the oldest forms of healing. It dates back, 3,000 years, and that it was a modality that was handed down from generation to generation. So if I was an acupuncturist, I would be training my child at this point to learn how to look at an animal or a person and pick acupuncture points. And not just acupuncture points, but herbs and chart up here because traditional Chinese medicine is not just acupuncture. It's about using herbs to do specific things in the body, and their whole diet and the way they eat every day, the foods they choose to eat have everything to do with what's ailing you at the time, what the seasons are, what the temperature is, what the humidity is, and the foods they pick aid them in dealing with that on a daily basis. Is so far different from how we eat. So, and that's just a part of their everyday eating and their culture. It wasn't introduced, acupuncture wasn't introduced to the West until the 17th and 18th centuries, and that's pretty, it was brought in then, and the International Veterinary Acupuncture Society was established in 1974, and this is the society now that is looking at acupuncture in a vacuum, like Western medicine looks at issues in a vacuum. That's it. That's all there is this. It doesn't, other things don't affect it. So the different modalities I mentioned earlier are dry needles. I showed you some of the needles. Acupuncture, that's where you inject liquids into certain acupuncture points to make sort of a longer lasting effect. And Dr. McDaniel, does anybody know Dr. Chuck McDaniel? He does a lot of acupuncture, and this is some stuff I got from him. He injects an oil and an iodine solution into certain acupuncture points depending on what's going on. And he does kind of a cookbook thing, so every horse that has, a hip issue might hit the same points treated, whereas from a traditional Chinese medicine, we take other things into consideration. We take into consideration tongue and pulse, which is one of the modalities we use to pick points, and I'll expound on that. And, diet, how can you alter the diet to decrease the amount of heat that's in a body, those sorts of things. Anyway, so that's how it differs from cookbook. Well, he's coughing. We're going to do acupuncture on him because he's coughing. And then there's Electro Acupuncture, which is just like a little battery charger almost. You have these wires that you hook up. They have little alligator clips on them that you hook up to the end of a needle, and then you can alter the frequency and the amplitude of the electric current, and you can actually see when you put it in, you can actually see it moving if you're really given a lot of juice. And I mostly use this for paralysis problems. Like I just did a downer cow here a couple months ago who had calving paralysis. So she calved, the calf got stuck in the birth canal, and it sat there overnight until the farmer could pull the calf out. Well, then it damaged a nerve called the obturator nerve that goes right through the pelvic canal. So that nerve is all wigged out, and it's paralyzed now because it's been damaged. So we do electroacupuncture. We did it once a day for 3 days, and then skipped a day, and did it on the 5th day, and that day the cow got up and walked, which is pretty fast for that kind of issue. I've had pretty good luck with it on calving paralysis cows. And then there's laser. This is the laser, and like I said, it doesn't hurt at all. It has a cord that hooks up to it, and then you just laser a point. Usually 4 seconds is average, so this goes pretty quick. You can just, 1, 1,000, 2, 1,000, 3, 1,004, 1, 1,000, 2, 1,000, 3, 1,004. That's about all the longer. If I want to get a larger area, like if he had a blown disc, and I wanted to get a bigger space than just a pinpoint acupuncture needle, I would take this head off, and I would do what's called a laser bath, where I slowly move this in a grid pattern over the area that I want to be either stimulated or sedated. And depending on how long you stimulate it, or I shouldn't say stimulate, however long you hold this on a point will determine whether you stimulate it or sedate it. So 1 to 12 seconds is usually stimulation. Anything beyond that is sedating. The laser you have to be careful with because it can actually burn hair. So you smell it smoking, I know that it's probably too long. And I have damaged some hair follicles on a dog, a dachshund that I was doing acupuncture on for a disc disease. We were doing a bath, and he came back like bounce back. And I'm like, well, you know, I just killed the hair off and, you know, damaged the hair follicles temporarily, but the hair grew back. So anyway, that can happen. I have my fighter moments. There's acupressure, and a lot of times, like, I'll show Mindy the points that, that's enough. I'll show Mindy the points I'm going to do on her dog, so she can follow up to do acupressure. Since she lives far away from me, I can't, it's not realistic for me to come down here every third day and do acupuncture on that dog. So I Sharpie the point, and on her dog it's going to be hard because it's black, but somehow we try to find a way so that she just uses her finger and will stimulate a point. And then chemoacupuncture is actually injecting blood into the point. I've never had to do that, and right now I couldn't even tell you what the indications were. Moxibustion, Mojo, quit, lay down. Mojo, moxibustion is heating up an acupuncture point. So there are conditions from traditional Chinese veterinary medicine that are cold, add heat to and get things moving, get the energy moving through a point, and then have little, they look like charcoal smudge sticks kind of, and you heat them up. This is used mostly on people because with animals and hair, it just doesn't go good together, but you light the end of this so it's glowing like incense, blow on it, get it going, and it's hot, and then you would just go closer and farther away to a point that you want it to heat up. But like I said, I don't do that very often. There's too much of a fire hazard in animals. Lay down. Lay down. Lay down. Okay, stay quiet. And then we can actually implant gold beads that are smaller than BBs. They're about the size of a pinhead, and you can inject them into certain points. They're really good for chronic back issues in dogs, chronic arthritis. Maybe like if the dog had the kissing things that anatomically are not going to change. They're going to be problems there all the time, and you want stimulation all the time. You can inject gold beads into those points. And in dogs, it's a surgical procedure. I don't know if they're doing it in horses right now. I watched Dr. Van Enklenberg at the Iowa Veterinary Acupuncture Clinic down here do it to dogs, and he